What are the primary functions of mitochondria in animal cells and how do they contribute to the energy production process in the body? Answer: mitochondria are known as the powerhouse of the cell due to their role in generating ATP adenosine triphosphate through cellular respiration. The primary functions of mitochondria include ATP production. Mitochondria use oxygen and glucose to produce ATP, which is essential for cellular activities. This process occurs in three main stages: glycolysis, the citric acid cycle, and oxidative phosphorylation, regulation of cellular metabolism. Mitochondria regulate metabolic pathways by controlling the breakdown of fatty acids and amino acids, which further supports ATP generation. Calcium storage and apoptosis regulation. Mitochondria play a key role in regulating calcium ion concentrations, which are crucial for cellular functions like muscle contraction. They also release pro-apoptotic factors during cellular stress, triggering programmed cell death, apoptosis when necessary. This mitochondrial function is crucial in veterinary medicine, especially when considering metabolic disorders in animals where mitochondrial dysfunction could lead to insufficient energy production. Which muscle type is responsible for involuntary movements in animals, and what are its distinguishing characteristics? Answer: the smooth muscle is responsible for involuntary movements in animals, unlike skeletal muscle, which is voluntary, and cardiac muscle, which is specialized for heart contractions. Smooth muscle is found in the walls of hollow organs, such as the intestines, bladder, and blood vessels. Characteristics of smooth muscle: involuntary control. It functions without conscious control, controlled by the autonomic nervous system. Non-striated. Unlike skeletal muscle, smooth muscle fibers lack the striations seen under a microscope. Spindle-shaped cells. Smooth muscle cells are elongated and taper at both ends, unlike the cylindrical fibers of skeletal muscle. Slow contractions. It contracts more slowly but can sustain longer contractions, which is essential for regulating functions such as digestion and blood pressure. Explain the significance of essential nutrients in animal diets and how do deficiencies in specific nutrients affect animal health. Answer: essential nutrients are those that animals cannot synthesize on their own in sufficient quantities and must obtain them through their diet. These include proteins, fats, carbohydrates, vitamins, and minerals. Each plays a critical role in maintaining health and supporting various physiological functions. Proteins are necessary for growth, repair of tissues, and enzyme function. Deficiencies can lead to stunted growth, muscle wasting, or immune system dysfunction. Fats provide energy, support cell structure, and aid in the absorption of fat-soluble vitamins A, D, E, K. A lack of fat can cause poor coat condition, weight loss, and lethargy. Carbohydrates provide immediate energy. While not always essential in every species, deficiencies may lead to a lack of energy, causing fatigue or poor metabolic function. Vitamins and minerals are involved in metabolic processes, bone health, and immune support. For example, vitamin A deficiency can lead to vision issues, while a calcium deficiency may cause skeletal abnormalities or weaken bones in growing animals. For specific species, the requirements for these nutrients may differ. For example, obligate carnivores like cats require higher levels of protein and certain amino acids like taurine, which are found in animal tissues. What are the key differences in housing and environmental care needs for carnivorous, herbivorous, and omnivorous species? Answer: the housing and environmental needs of animals vary significantly based on their dietary habits and natural behaviors. Carnivores, e.g., dogs, cats, require a diet rich in animal-based proteins and fats. Their enclosures need sufficient space to allow for exercise, play, and resting, with temperature and humidity control to prevent stress. They may also need enrichment such as toys that simulate hunting or interactive feeding. Herbivores, e.g., rabbits, guinea pigs, horses have specific needs for fiber, requiring access to fresh hay, grasses, and leafy greens. Their enclosures should include areas for grazing or foraging, along with space for running or jumping. They are more sensitive to temperature extremes and require cooler, well-ventilated environments. Omnivores, e.g., pigs, raccoons, chickens, need a balanced diet of both plant and animal material. Housing must be tailored to allow access to various food sources and provide adequate space for exercise and exploration. Temperature and humidity controls should prevent extreme conditions, especially for poultry, which are sensitive to both heat and cold. Discuss the role of positive reinforcement in animal behavior modification. How does this technique differ from aversive methods? Answer: positive reinforcement involves rewarding desired behaviors, making it more likely that the behavior will be repeated. Common rewards include treats, praise, or toys. This method is based on the principle of operant conditioning and strengthens the bond between the animal and handler by reinforcing trust and cooperation. Benefits of positive reinforcement: promotes a stress-free, trusting relationship between animals and handlers, encourages the learning of new behaviors and the modification of undesirable behaviors in a humane and effective way, avoids fear and aggression that may result from aversive methods. In contrast, aversive methods, e.g., punishment, negative reinforcement, involve applying unpleasant stimuli, e.g., shock collars, loud noises, to discourage unwanted behavior. These techniques can lead to fear, anxiety, and aggression in animals, potentially damaging the animal-handler relationship and leading to unintended consequences such as defensive behaviors. It's crucial to use positive reinforcement when possible, as it promotes long-term behavior change without causing harm. Mr. Johnson is tasked with restraining a large dog for a veterinary procedure. The dog is fearful and tries to escape. How should Mr. Johnson safely and effectively restrain the dog while minimizing stress? Answer: in this scenario, Mr. Johnson should follow these steps to safely and effectively restrain the dog while minimizing stress. Calm environment. First, Mr. Johnson should ensure the environment is quiet and free from sudden movements or loud noises that could increase the dog's anxiety. Gentle approach. Approach the dog slowly and speak in a calm, reassuring voice. This helps prevent the dog from becoming more fearful or aggressive. Proper restraint. Use a leash or muzzle if necessary to prevent biting. For larger dogs, a two-person restraint technique may be necessary. One person should hold the dog's head and neck while the other controls the body by gently wrapping an arm around the torso, minimizing stress. Place the dog in a position that supports its body without causing strain. Preemptive sedation may be considered if the dog is extremely fearful, but this should only be done under veterinary guidance. Restraint techniques. For veterinary procedures, use restraint devices such as a dog restraint bag or specialty chairs to limit movement while allowing the animal to remain as comfortable as possible. Safety for handler. Ensure that the handler is positioned properly to prevent injury from sudden movements by the dog. Be the route of drug administration: oral, intravenous, subcutaneous, intramuscular impact, the onset, duration, and effectiveness of a drug. Answer: the route of administration of a drug determines how quickly it reaches the bloodstream, how long it remains active, and its overall effectiveness in treating the animal. Oral administration involves the drug being ingested and absorbed through the gastrointestinal tract. The onset of action is slower compared to other routes because the drug must first pass through the digestive system and liver. Intravenous Roman administration delivers the drug directly into the bloodstream, ensuring the fastest onset of action. This is typically used for urgent treatments or when immediate drug effects are needed. The duration of effect may be shorter, and the drug may be metabolized more quickly. Subcutaneous (SC) injections deliver the drug beneath the skin, where it is absorbed into the bloodstream more slowly than IV administration. This route is used for drugs that require a more sustained release. The onset is slower than IV, but faster than oral. Intramuscular administration injects the drug into the muscle tissue, where it is absorbed into the bloodstream. This route provides a moderate onset of action, and the drug is usually absorbed over time. IM injections are often used when a drug cannot be given orally or needs to be delivered at a controlled rate. What are the major side effects of common NSAIDs used in veterinary medicine, and what precautions should be taken when administering them? Answer: non-steroidal anti-inflammatory drugs, NSAIDs, are commonly used in veterinary medicine to manage pain and inflammation. However, they come with potential side effects, particularly when used long-term or in inappropriate dosages. Gastrointestinal issues. The most common side effects include gastric ulcers, vomiting, and diarrhea. NSAIDs inhibit the enzyme cyclooxygenase COX, which is involved in the production of prostaglandins that protect the stomach lining. Renal toxicity. NSAIDs can affect kidney function, particularly in animals with pre-existing renal conditions or dehydration. This can result in decreased urine production or kidney failure. Hepatotoxicity. Some NSAIDs may cause liver damage, especially in animals that are already compromised or are on multiple medications. Precautions. Perform a thorough pre-treatment assessment of kidney, liver, and gastrointestinal health. Always administer the drug with food to minimize gastrointestinal upset. Monitor liver and kidney function regularly in animals on long-term NSAID therapy. Avoid administering multiple NSAIDs simultaneously and be cautious when combining them with corticosteroids. Discuss the role of antibiotics in veterinary practice, highlighting the risks associated with misuse and antimicrobial resistance. Answer: antibiotics are essential in treating bacterial infections in animals, but their misuse can lead to significant health risks, including the development of antimicrobial resistance and risks of misuse. Overuse or incorrect use of antibiotics can result in the development of resistant bacterial strains, making infections harder to treat. Inappropriate prescription of antibiotics, such as using broad-spectrum antibiotics when a narrow-spectrum option would suffice, can contribute to resistance. Failure to complete a full course of antibiotics or using antibiotics for viral infections can also promote resistance. Prevention of AMR. Antibiotics should be prescribed based on culture and sensitivity testing, which identifies the specific bacteria causing the infection and the antibiotics that will be effective. Strict guidelines for antibiotic stewardship should be followed, limiting their use to necessary cases and ensuring correct dosing and duration. How do different bedding types affect animal health, and what other factors to consider when choosing bedding materials for different species? Answer. The type of bedding used in animal enclosures significantly impacts their health, comfort, and hygiene. Factors to consider include absorbency, comfort, dust production, and the species-specific needs. Absorbency. Bedding should absorb moisture from urine to prevent wet conditions, which can lead to skin irritation, respiratory issues, and the growth of bacteria or fungi. Materials such as shredded paper, wood shavings, and straw are commonly used for their absorbent properties. Comfort. Bedding should be comfortable for animals to lie on and should provide enough insulation to prevent cold or heat stress. Soft bedding like fleece or hay is suitable for small mammals and some avian species. Dust and allergens. Materials like cedar and pine can release harmful oils that irritate the respiratory tract. Hay, paper, and aspen wood shavings are better for sensitive animals like rabbits and guinea pigs. Species-specific needs. For aquatic species, absorbent materials that do not get soggy quickly, like aquatic moss, are used. Reptiles may require bedding like coconut fiber or sand depending on humidity and temperature requirements. What is the role of anti-inflammatory drugs in veterinary medicine, and what are the common side effects to watch for in animals? Answer. Anti-inflammatory drugs are commonly used in veterinary medicine to treat pain, swelling, and inflammation associated with conditions like arthritis, injury, or infections. These drugs are typically categorized into non-steroidal anti-inflammatory drugs, NSAIDs and corticosteroids. NSAIDs, e.g. carprofen, meloxicam, work by inhibiting enzymes involved in the production of prostaglandins, which cause inflammation and pain. Corticosteroids, e.g. prednisone, dexamethasone, reduce inflammation by suppressing the immune response and stabilizing cell membranes. Common side effects: GI upset, vomiting, diarrhea, or ulcers, especially with NSAIDs. These drugs should be administered with food to minimize gastrointestinal distress. Kidney and liver issues. Both NSAIDs and corticosteroids can affect organ function, requiring regular monitoring of liver and kidney parameters. Weight gain and behavioral changes. Corticosteroids can cause increased appetite, thirst, and urination, as well as mood changes or restlessness. Explain the concept of drug interactions in veterinary pharmacology and how they can impact animal health. Answer. Drug interactions occur when one drug affects the activity of another when both are administered together. These interactions can either increase or decrease the effectiveness of the drugs involved or lead to unexpected side effects. Types of drug interactions. Pharmacokinetic interactions. These occur when one drug alters the absorption, distribution, metabolism, or excretion of another. Pharmacodynamic interactions. These occur when two drugs have additive, synergistic, or antagonistic effects on the same physiological process. For instance, combining two sedatives can result in excessive sedation, while combining a pain reliever with an anti-inflammatory can potentiate its impact on animal health. Drug interactions can increase toxicity. Combining certain antibiotics with NSAIDs can cause kidney damage. Some interactions may reduce therapeutic effects, leading to treatment failure. In critical cases, drug interactions can cause life-threatening conditions such as arrhythmias or respiratory depression. What is the significance of the presence of nucleated red blood cell ECS in a blood smear, and how should you interpret this finding in a clinical setting? Answer. The presence of nucleated red blood cell ECS in a blood smear is an abnormal finding that suggests the bone marrow is releasing immature erythrocytes into the bloodstream. This can be caused by severe regenerative anemia, bone marrow disease, or certain toxicities. Nucleated red blood cells are typically seen when the body is attempting to compensate for significant blood loss or hemolysis. In a clinical setting, the presence of AECS would prompt further investigation to assess the underlying cause, such as anemia. The body may be producing more red blood cells in response to blood loss or hemolysis, leading to the premature release of AECS. Bone marrow disorders. Diseases such as myeloproliferative disorders can result in abnormal release of cells, toxins, or infections. Certain infections, e.g. babesiosis, or toxins, e.g. Lead poisoning can also affect marrow function. In addition to identifying a complete blood count (CBC) and additional diagnostic tests e.g. bone marrow aspiration may be needed for a thorough diagnosis. Explain the importance of pH, protein, glucose, and ketones in a urine sample and what each of these chemical parameters might indicate about a patient's health. Answer: urinalysis is a critical diagnostic tool providing valuable information about a patient's metabolic and renal health. Key chemical parameters assessed in a routine urinalysis include pH. The pH of urine helps evaluate the acid-base balance. A normal urine pH ranges from 5.5 to 7.0, but this can vary depending on diet. An acidic pH may indicate conditions such as dehydration or starvation, while an alkaline pH could suggest urinary tract infections (UTIs) caused by urease-producing bacteria. Protein. The presence of protein in urine, proteinuria, suggests kidney disease or damage. Normally, protein is absent or present only in trace amounts. High levels of protein can be indicative of glomerulonephritis, nephrotic syndrome, or urinary tract infections. Persistent proteinuria is often associated with glomerular damage and requires further investigation. Glucose. Glucosuria occurs when glucose exceeds the renal threshold, normally 108 mdl in dogs. This can indicate diabetes mellitus or, in some cases, stress-induced hypoglycemia, particularly in cats. Ketones. The presence of ketones in urine, ketonuria, is commonly associated with conditions like diabetic ketoacidosis or starvation. Ketones are produced when the body breaks down fat for energy due to inadequate glucose metabolism. Dr. Harris is examining a fine needle aspirate FNA from a mass on a dog's liver. The cytology results show clusters of pleomorphic, hyperchromatic cells with irregular nuclear contours and prominent nucleoli. Based on these findings, what is your likely interpretation, and what further actions should Dr. Harris consider? Answer: based on the cytology results, the description of pleomorphic hyperchromatic cells with irregular nuclear contours and prominent nucleoli strongly suggests a neoplastic process, possibly a malignant tumor. The variability in cell shape and size, pleomorphism, and the abnormal nuclear features point to a carcinoma or sarcoma. Dr. Harris should consider the following next steps. Confirming the diagnosis. Additional tests, including immunohistochemistry, could help identify the tumor's origin and staging. Further diagnostics such as ultrasound, CT scans, or biopsies might be necessary to assess whether the cancer has spread to other organs. Treatment options. Depending on the type of cancer, treatment options may include surgery, chemotherapy, or radiation therapy. It is important to note that cytology alone can be insufficient for a definitive diagnosis and histopathological examination. Biopsy is often required for tumor classification. Explain the purpose of sensitivity testing, such as the Kirby-Bauer method, in veterinary microbiology and how it impacts treatment decisions for bacterial infections. Answer: sensitivity testing, or antimicrobial susceptibility testing, is a critical procedure in veterinary microbiology used to determine the most effective antibiotic for treating bacterial infections. The Kirby-Bauer disc diffusion method is commonly used where antibiotic-impregnated paper discs are placed on an agar plate inoculated with the bacteria of interest. The zone of inhibition, or the area around the disc where bacteria cannot grow, is measured to determine the bacteria's susceptibility to the antibiotic. The importance of sensitivity testing includes selecting the appropriate antibiotic. It helps identify which antibiotics the bacteria are susceptible to, ensuring that the most effective drug is prescribed. Avoiding resistance. By using sensitivity testing, clinicians can avoid overprescribing antibiotics, which can lead to the development of antimicrobial resistance. Tailoring treatment. It allows for more precise and targeted treatment, which is particularly critical in veterinary patients with chronic or resistant infections. In cases where the organism is resistant to multiple drugs, clinicians may need to consider alternative therapies or combination treatments. What are the advantages and disadvantages of using cystocentesis versus catheterization for obtaining a urine sample in a veterinary patient? Answer: both cystocentesis and catheterization are commonly used techniques to obtain a urine sample, each with its own advantages and disadvantages. Cystocentesis, needle aspiration directly from the bladder, is considered the most sterile method for urine collection. It provides a clean sample that is not contaminated by the lower urinary tract. However, cystocentesis can be more challenging to perform, especially in difficult to palpate bladders, and carries the risk of bladder perforation or injury if not done correctly. Catheterization involves inserting a sterile catheter through the urethra into the bladder. This method can be easier to perform in awake or sedated patients, but it carries a higher risk of contamination, especially in cases of urethral infection or inflammation. Additionally, catheterization may cause trauma to the urethra or bladder if not done carefully. Both methods have their place depending on the clinical situation. Cystocentesis is preferred when obtaining a clean, uncontaminated sample is critical, such as in cases of suspected urinary tract infection (UTI). Describe how radiographs are created and the principles behind interpreting an X-ray image. How would you approach interpreting a radiograph of a suspected fractured limb in a dog? Answer: radiographs are produced when X-rays pass through the body and interact with a detector or photographic film. The denser tissues like bone absorb more X-rays and appear white on the radiograph, while softer tissues such as muscles and organs allow more X-rays to pass through and appear darker. Key principles for interpreting a radiograph. Exposure. Ensure that the radiograph has appropriate exposure, contrast, brightness, and sharpness for the structures being evaluated. Positioning. Correct positioning of the patient is essential to obtaining diagnostic quality images, as incorrect positioning can distort anatomical structures. Evaluation of bone structures. When assessing a fractured limb, look for discontinuity in the bone, abnormal angulation or misalignment of the bone fragments. Fractures can appear as sharp breaks or fissures in the bone, and you may need to examine multiple views, lateral, VD, etc. For complete assessment, in the case of a suspected fractured limb, be sure to examine the alignment, the number and type of fractures, e.g. simple, comminuted, and look for any secondary complications such as joint dislocations, soft tissue damage, or signs of infection. How does ultrasound work in veterinary practice, and what are its primary uses in diagnosing abdominal conditions? Answer: ultrasonography uses high-frequency sound waves to create images of internal body structures. The sound waves are emitted by a transducer and are reflected back by different tissues, which is then converted into an image by the ultrasound machine. In veterinary practice, ultrasound is commonly used for abdominal imaging. It allows visualization of soft tissues and organs such as the liver, kidneys, spleen, and bladder. Conditions like liver disease, kidney stones, or abdominal masses can be diagnosed using ultrasound. Cardiac evaluation. Doppler ultrasound can assess blood flow and heart function, helping diagnose heart disease. Pregnancy diagnosis. It is widely used for confirming pregnancy in animals and assessing fetal development. Ultrasound is non-invasive and does not involve radiation, making it an excellent tool for evaluating soft tissues and real-time organ movement. What are the differences between MRI and CT scans in veterinary practice, and when might each be preferred for diagnosing neurological conditions in a dog? Answer: MRI and CT scans are both advanced imaging techniques used to evaluate internal structures, but they differ in their technology and applications. MRI, magnetic resonance imaging, uses strong magnetic fields and radio waves to create detailed images of soft tissues such as the brain, spinal cord, and muscles. MRI provides excellent contrast resolution for soft tissues and is the preferred choice for evaluating neurological conditions like brain tumors, spinal cord injuries, and herniated discs. CT, computed tomography, uses X-rays to produce cross-sectional images. CT scans are quicker and more suitable for imaging bone structures, such as identifying fractures or tumors involving bones. While CT provides less detail in soft tissue compared to MRI, it is useful in emergency situations for assessing head trauma or intracranial hemorrhage. For diagnosing neurological conditions, MRI is generally preferred because of its superior soft tissue imaging capabilities, while CT may be used in trauma cases for faster assessment of bony structures. What are the key components of a blood smear, and why is the use of proper staining techniques essential in identifying abnormalities like anemia or thrombocytopenia? Answer: a blood smear is prepared by spreading a small amount of blood on a slide and allowing it to air dry. Proper staining techniques, such as Wright stain or Romanowski stain, are used to differentiate and identify various blood components like red blood cells, white blood cells, and platelets. The importance of staining lies in the ability to differentiate cell types. Staining highlights different parts of the cells, allowing for the identification of abnormalities such as anisocytosis, variations in red blood cell size, or leukocytosis, elevated white blood cell count. Identify abnormalities. Staining helps identify abnormal red blood cell morphology indicative of anemia, e.g. microcytic, hypochromic, or abnormal platelet count, e.g. thrombocytopenia. Assess cell health. The stain helps assess the degree of cell maturity and the presence of any infectious agents or parasites. A well-prepared and properly stained smear is essential for an accurate diagnosis of blood-related conditions. What is thrombocytopenia, and how would you interpret a blood smear from a patient with this condition? Answer: thrombocytopenia refers to a low platelet count in the blood. which can be caused by several factors, including immune-mediated destruction, bone marrow disorders, increased platelet consumption, e.g., DIC, or sequestration in organs like the spleen on a blood smear. The following findings may indicate thrombocytopenia, reduced platelet count. Fewer platelets are observed under the microscope compared to normal. Platelet clumping. In some cases, platelets may aggregate, which can be mistaken for a higher count. Large platelets, occasionally larger than normal platelets, megakaryocytes, may be seen indicating regenerative thrombocytopenia where the bone marrow is attempting to compensate. Thrombocytopenia can lead to increased bleeding risks, and further testing, including bone marrow aspiration or clotting factor analysis, may be required to determine the underlying cause. Mr. Johnson, a veterinary technician, is treating a dog with suspected enteritis. After reviewing the clinical signs, he prepares to administer a medication. The dog has a history of chronic vomiting and diarrhea. What steps should Mr. Johnson take to ensure proper medication administration considering the diagnosis of enteritis? Answer: Mr. Johnson should follow these steps to ensure proper medication administration. Assess hydration status. Given the dog's history of vomiting and diarrhea, it is crucial to assess hydration status. Dehydration is a common complication in enteritis. Mr. Johnson should check for signs of dehydration such as dry mucous membranes or sunken eyes. Administer IV fluids. If dehydration is present, Mr. Johnson should administer intravenous fluids to restore hydration levels. This can help prevent further complications and support the dog's recovery. Select the appropriate medication. The primary treatment for enteritis may include antibiotics if a bacterial infection is suspected, or anti-inflammatory medications if it's viral or idiopathic. Mr. Johnson should select the medication that aligns with the suspected cause of enteritis. Follow dosage guidelines. Ensuring proper dosing is critical. Mr. Johnson should refer to the specific guidelines for the chosen medication to prevent underdosing or overdosing. The appropriate dosage will depend on the dog's weight, age, and the severity of the condition. Monitor for side effects. Since enteritis treatments often involve medications that can irritate the gastrointestinal system, Mr. Johnson should monitor the dog for any side effects like further vomiting or signs of discomfort. What is the role of the thyroid gland in regulating metabolism in animals, and how might an imbalance in thyroid hormones present in veterinary patients? Answer: the thyroid gland is responsible for producing thyroid hormones and T, which regulate metabolism in animals. Thyroid hormones and metabolism increase metabolic rate. Thyroid hormones increase the metabolic rate by stimulating the production of heat and the breakdown of carbohydrates, fats, and proteins to produce energy. Thermoregulation. These hormones also influence thermoregulation, helping to maintain body temperature. Imbalance in thyroid hormones, hypothyroidism. If the thyroid gland produces too little hormone and the animal's metabolism slows down, common signs include lethargy, weight gain, dry skin, and hair loss. Hypothyroidism. If the thyroid gland produces excessive hormones, the metabolism speeds up, leading to symptoms like increased heart rate, weight loss, excessive thirst, and hyperactivity. What is the difference between innate immunity and adaptive immunity in animals, and how do they work together to protect the body from pathogens? Answer: innate immunity. Definition: innate immunity is the body's first line of defense against pathogens. It is non-specific, meaning it does not target specific pathogens but responds to a broad range of threats. Components: includes physical barriers, skin, mucous membranes, cellular components, phagocytes like neutrophils and macrophages, and proteins. Complement system. Response: the response is rapid and does not require prior exposure to the pathogen. Adaptive immunity. Definition: adaptive immunity is specific and develops over time. It targets particular pathogens based on prior exposure or vaccination. Components: includes B cells, which produce antibodies, and T cells, which destroy infected cells. Response: the adaptive immune response is slower initially, but provides long-term protection by remembering pathogens for future encounters. How they work together. Innate immunity provides an immediate response to pathogens, while adaptive immunity offers long-term defense. In some cases, innate immunity triggers the adaptive immune response by presenting antigens to T cells, which then initiate a more specific attack. What is the physiological significance of the blood-brain barrier in animals, and how does it protect the central nervous system? See. Answer: the blood-brain barrier (BBB) is a selective permeability barrier that protects the central nervous system (CNS) from potentially harmful substances in the blood, such as toxins, pathogens, and drugs. Structure: the BBB is formed by endothelial cells in the brain's blood vessels that are tightly joined, preventing large molecules or harmful substances from crossing into the brain. Function: protection. It limits the entry of pathogens and toxic substances, thus safeguarding the brain from infections and chemical disruptions. Selective transport. Essential nutrients like glucose and amino acids are selectively transported into the brain while waste products are expelled. Challenges in veterinary medicine. Certain medications, such as antibiotics or chemotherapy agents, may not be able to cross the BBB. This is important when treating neurological diseases or brain infections, as alternative drug delivery methods, e.g., direct injection, may be necessary. What are the primary hormones produced by the adrenal glands, and how do they regulate physiological functions in animals? Answer: the adrenal glands produce several hormones that are vital for maintaining physiological balance in animals. Corticosteroids. Cortisol, the primary glucocorticoid. Cortisol helps manage stress, regulate blood sugar, and control inflammation. Aldosterone, a mineralocorticoid that regulates sodium and potassium levels, which in turn affect blood pressure. Catecholamines, adrenaline, epinephrine, and noradrenaline, norepinephrine. These hormones prepare the body for the fight or flight response by increasing heart rate, blood pressure, and energy availability during stress. Relevant regulation in veterinary practice. Adrenal gland dysfunction, e.g., Cushing's disease or Addison's disease, can cause significant metabolic disturbances, and appropriate diagnostic testing, e.g., a CTH stimulation test, is crucial. How does the structure of synovial joints contribute to their function in animal movement? Answer: synovial joints are the most common type of joint in animals, allowing for a wide range of movement. Their structure includes several components: the articular cartilage, smooth cartilage covering the ends of bones, reducing friction and enabling smooth movement. Synovial fluid, a lubricating fluid inside the joint cavity that reduces friction and nourishes cartilage. Joint capsule and ligaments. The joint capsule surrounds the joint, providing structural stability, while ligaments connect bones and limit excessive movement. Bursae, fluid-filled sacs that cushion joints and reduce friction between tendons, ligaments, and bones. This structure enables efficient control movement, and its dysfunction, e.g., arthritis or ligament tears, can lead to pain and mobility issues in animals. What is the significance of the estrous cycle in female animals, and how does it vary across species? Answer: the estrous cycle refers to the reproductive cycle in female animals, during which they become receptive to mating. It includes several phases. Proestrus, the period before ovulation, marked by the development of follicles in the ovaries and the onset of estrous behavior. Estrus, the period of sexual receptivity and ovulation, where the female is fertile and can mate. Metestrus, the phase after ovulation, during which the corpus luteum forms and prepares for potential pregnancy. Anestrus, a period of reproductive inactivity, common in species with seasonal breeding patterns. The length and characteristics of the estrous cycle vary across species. For example, dogs have a biannual cycle while cattle may have a more regular estrous cycle. Understanding these variations is crucial for managing breeding and fertility in veterinary practice. How do B cells contribute to adaptive immunity in animals, and what is their role in responding to pathogens? Answer: B cells are a key component of adaptive immunity. They are responsible for producing antibodies, which are proteins that specifically target and neutralize pathogens. Activation: when B cells encounter an antigen, e.g., from a virus or bacteria, they are activated by helper T cells and begin to proliferate. Antibody production: activated B cells differentiate into plasma cells, which secrete large quantities of antibodies specific to the encountered pathogen. Memory B cells: some B cells become memory cells which remember the pathogen and provide faster, more effective responses if the same pathogen is encountered again. This process is central to the animal's ability to fight infections, and vaccines work by stimulating B cells to produce memory cells without causing disease.